Hi there, I'm Dr. Constance Wong, and today I'm going to talk about a dental headline that made the news. So on the Times newspaper, they stated that gum disease sufferers are 70% more likely to get dementia. So many of you will be asking, is this going to affect me? So gum disease is inflammation of the gums when plaque builds up on your teeth and gums and causes damage. There's different levels of gum disease ranging from symptoms such as bleeding gums to actually extensive loss of the gums and the supporting bone around the teeth, which can lead to tooth loss. But just because your dentist has told you your gums are bleeding does not mean that you're 70% more likely to get dementia, and I'll explain why. So the first point, in the study that this newspaper was talking about, they only looked at patients who were suffering from really chronic, long-standing gum disease, and they had a history of 10 years plus. So if you've got a little bit of gingivitis or a bit of mild perio, this research wouldn't necessarily apply to you. Also, the second point is that this statistical value, 70%, needs to be taken lightly. And to explain that, I'll explain the results. So, the researchers, they looked at a Taiwanese national health database, and they looked to find people who had periodontitis or severe gum disease, and out of those people, how many of them went on to develop Alzheimer's. They also then looked at the people who didn't have periodontitis, and from then, how many of those developed Alzheimer's. Or dementia, as I forgot to say earlier. So you can see from the values that more people in the periodontitis group developed Alzheimer's than the people in the non-periodontitis group. So the conclusion that they made was that people who have a 10-year plus history of chronic periodontitis are at a higher risk of developing Alzheimer's, and they use the statistics, the hazard ratio of 1.707, and that's where the 70% comes from. But if you look back at the previous results that I was showing you, the number of people who did get periodontitis was, well, in that database was about 9,000, and out of those 9,000, only about 100 actually went on to develop Alzheimer's. So that's only 1 in 100 people, or 1.24% of that group. So that goes on to my third point. Just because you have periodontitis does not mean that you're going to definitely get Alzheimer's. This study found an association, not an actual causal link. So you can't say that if you have periodontitis, you'll get Alzheimer's, or vice versa. You could even look at it in more depth and say that people who have early Alzheimer's symptoms, they may be more likely to forget about their oral hygiene, so the oral health may decline, and that may be the reason why they get periodontitis. That's one theory. You can't also say that brushing your teeth will help to reduce your risk of Alzheimer's as well. But in conclusion, yes, the results have made a significant point and highlighted the importance of good oral health. However, there's lots of different reasons and factors why people develop Alzheimer's, and we don't even know the true cause of the disease. So I hope in this video I've helped to explain the research and hopefully reassured people that just because you have gum disease doesn't mean you'll get Alzheimer's. But there is more and more research coming to light now that links poor oral health to other medical conditions such as heart disease and diabetes. Toothbrushing and using teepees and floss is such a simple yet effective way of maintaining a really good healthy mouth, and if everyone focused on doing this one simple task effectively and efficiently, it would have a huge positive impact on everyone's general health. So I hope you enjoyed the video. Thank you for watching. Please share the video if you enjoyed it, and if you want to see more videos, please follow my Facebook pages, Dr. Constance Wong and Andre Hedger Excellence in Dentistry. Otherwise, have a great day, and I'll see you same time next week. Take care. Bye.